In the world of medicine, one singular chemical reigns supreme as everyone's favorite. And when I say everyone, I mean doctors agree, pharmacists agree, nurses agree, patients agree. If any of you have ever taken this, you know that it is a miracle medicine. It's so good, in fact, many people are pushing it to become over the counter, meaning you don't need a prescription for it anymore. Now, I hate to burst your bubble, but that's not going to happen, and I'll explain why. I personally have taken this medication. In fact, I have it sitting right here. It is one of my favorite to take, although I haven't needed it in several years. And the reason why is because it creates a sense of relief from the disease that it prevents, cures, or mitigates. And it's very quick. And there's like virtually no side effects. I can't say there are no side effects, but I can say that there are virtually no side effects. It's almost like magic. I remember the first time I took this, I was like, this isn't going to work. I knew that there was hype around this medication before I took it. And I was like, it can't be real. It cannot work as well as everybody says it does. Well, it indeed does. And that medication is laxatives. Wait, Ondansetron. I'm Grant Harding. I'm a licensed pharmacist in 3 states and a medication pricing expert. Today we're going to be talking about Ondansetron, baby. This is the active chemical in Zofran. Aside from it being an amazing wonder drug, it has a really cool name too. I think Ondansetron and Zofran both sound so cool. What is Ondansetron? It's a medication to treat nausea. If anyone watching this video has ever experienced nausea, it's not fun, right? Whenever you feel like you're going to throw up, or maybe your head's dizzy, or it's just a very unpleasant feeling all around. People will do whatever it takes to get relief from nausea, and thankfully it doesn't take much. This is just a 4 milligram tablet. The doses of Ondansetron are actually very weird. I never noticed that until right now. It's normally a 4 or an 8 milligram tablet. I have no idea why instead of a 5 or 10. It just is what it is. And from a pharmacist perspective, I actually like that because I know that, or I would presume the difference between a 4 and a 5 milligram Ondansetron tablet is very quite inconsequential. But the fact that it is a 4 instead of a 5 actually reduces errors. Whenever you write out a prescription, or if you're giving one over the phone, whenever I hear 4 milligram, it shifts my mind to Ondansetron, which is what's intended. When we talk about Ondansetron, the doses, we also have to talk about the dosage form. There's 4, I believe. There's a tablet, just regular tablet. You put it in your mouth and you swallow it. And then there's an orally disintegrating tablet, which is actually what I have here today. You see how it says ODT on there? Like, how do I show this to you without giving out my personal information? These tablets are very popular because whenever somebody is nauseous, it's difficult to swallow. Sometimes you get so nauseous you can't even swallow water. So having this orally disintegrating tablet is very beneficial for someone who is going to throw up everything. The tablets are very, very small. So this is the 4 milligram, I believe. I mean, look how tiny this is. And you put this on top of your tongue and it just dissolves. And then you swallow the particles that it dissolves from. If there's any nurses watching, you're like, what is he talking about? That's not how that works. Well, yes, it is. This is a very common misconception. People think orally disintegrating tablets are sublingual tablets, and then it gets absorbed in the mucosal cells of the mouth. That is not what this is. This is an orally disintegrating tablet. This means exactly what it sounds like. It just falls apart almost immediately whenever you put it on your tongue, and then it's easier to swallow. Is there some absorption in the mouth? Probably. There's probably some. But this is designed to actually be swallowed. You could swallow this orally disintegrating tablet whole if you really wanted to. This is a very important distinction, okay? Because the regular tablet, the non-orally disintegrating tablet, people are less preferred, or people less prefer that one because they don't want to swallow something, you know? It's annoying to say the least whenever you're nauseous. Well, you can actually crush a regular tablet. That's a very important thing to know, if your doctor prescribes you the orally disintegrating tablet and it's not covered or it's very expensive, I don't know why. Every once in a while, it's just very expensive. I have no clue as to why that happens sometimes. They could simply switch to a regular tablet and you can crush it if you want to. There's no problem with that at all. It also comes in a liquid. The liquid is very expensive. I would say stay away from the Ondansetron liquid. People love liquids. Immediately, probably somebody watching this video is like, well, what if they have a G tube? Or like, what if they can't swallow or something? Yeah, it's nice to have a liquid, but you have to look at the cost of it too. You have to look at the value you're getting from it. If it's, I don't know, 20 times more expensive than a tablet, I'm picking the tablet every single time. If it's like 1 cent more expensive than the tablet, then yeah, I would like the liquid. Why not, you know? It also comes as an injection. This is just pretty much standard. If you roll into a hospital, you're going to get IV fluids and Ondansetron pretty much. The way Ondansetron works is pretty cool. It's a 5-HT3 antagonist. What the heck does that mean? 5-HT3 is a fancy way of saying serotonin, but it's a kind of a specific serotonin receptor, and it plays a major role in nausea, obviously. These receptors are found in the brain as well as the gut. And that makes sense whenever we're talking about nausea, right? People often say the gut is like the second nervous system or the second brain, and it's very true. The gut communicates with each other, and it has its own little thing it does sometimes. And of course, the brain talks to the gut as well, but it's kind of interesting how the digestive tract has its own little world down there. Once you take the Ondansetron, these chemicals will bind to the receptors, and they'll say, no more serotonin. No more. We don't want any more serotonin. We're full. Get out of here. And that's what creates the soothing relief from the nausea. So you have a lot of questions now because serotonin is the happiness molecule, right? Everybody on the internet, it's not my fault. My body doesn't produce serotonin. I can't get happy because I don't have serotonin. Okay, well, it's not that simple, first of all. Second of all, yes, serotonin also plays a role in digestion. Let me ask you this. Ask anybody who has taken an antidepressant, one of those SSRIs, whenever they stopped it, or perhaps whenever they started it, but more than likely whenever they stopped it, especially if they stopped it abruptly, they had probably lots of gastrointestinal upset. They probably had diarrhea. They probably had some nausea, honestly, because serotonin, besides being the happiness molecule, also helps with digestion. What about the risks of Ondansetron? Quite frankly, there's not much, but there's one that we have to talk about. And this is the one thing that people always bring up in conversation whenever we talk about making this available over the counter. And it's this. A long time ago, before I was born, probably not, but still a long time ago, there were reports of Ondansetron causing something called QT prolongation. Okay, so whenever you look at the beep, beep, beep of the heart monitor, that last little wave kind of gets extended. And that can cause something called torsades de la Pointes or something. I don't know how to pronounce that, but it's basically an arrhythmia, which can be fatal. It's very serious. That probably was dose dependent. They used to give like really high doses comparatively of Ondansetron. It'd be like 24 milligram IV. And that's where this association started. So even though most people, and I agree with this, I have the same thought process, agree that, the low dose, 4 milligram, 8 milligram oral Ondansetron is not going to cause QT prolongation, we still have to pretend like we think it does. Because it doesn't pay to be adventurous when we're talking about medication interactions. In fact, quite the opposite. People want to protect their licenses, they want to protect their livelihood, they have families to feed. If they got that piece of paper ripped away from them, what are they going to do? So everybody's very ultra conservative with this particular topic. If a doctor prescribes you Ondansetron and the little computer system at the pharmacy flags for QT prolongation, I would say 9 times out of 10 they're going to get a call from the pharmacy and say, are you sure you want to do this? And then the doctor's normally like, yeah. And then we document it and everybody's happy. QT prolongation is actually the bane of my existence. Many drugs have this warning, and many of them interact with other drugs that also have this warning, and then it creates this huge, I guess, cloud of uncertainty, and everybody, like I mentioned before, wants to be ultra conservative in this situation. But it's a spectrum. It depends on several different factors. It depends on what the drugs are that are involved. It depends on age. It depends on gender. It depends on electrolyte abnormalities. So you can never really say, okay, you can't take this because of the QT warning. And you can never say you can take this, you can ignore the QT warning. It really depends on the personal situation. And that is probably why you will never see this over the counter. Ugh, I wish. I love this drug. I love all drugs, but I love this one a lot.